Hey everybody, I'm Liz Lacey. I'm an advanced level schema therapist and trainer out of the New York, New Jersey Schema Institute. I train nationally and internationally, and I want to just talk to you for a moment about what you can do to help yourself heal. Right? At this point, you probably know that schema therapy is great for long-standing patterns and long-standing pain. And there's several things that you can do to really help your therapy along. So the first one is be open to experiential exercises in and out of session. I know it might seem like imagery and chair work feels a little bit awkward. It's not natural to do at first, but it is incredibly effective, and it's actually shown to be quite a bit more effective and faster acting than even just talking through something. And if you're interested, talk to your therapist about really how that works. They can send you studies to really show you that we're talking, this is an evidence-based model. So everything we do in schema therapy is for a good reason, and your therapist should be able to tell you what that reason is. Slow down to go fast. So your therapist might really, especially if you're working with me, but your therapist might really start to slow you down and help you look at something and unpack something that might seem like a small thing. But slowing it down, unpacking it, seeing what's really going on is going to have a huge ripple effect through your therapy and through lots of areas of your life. Because if a small thing is happening one place, it's probably happening lots of other places. Make sure to complete a schema mode inventory and a schema inventory with your therapist and really talk it through so that you understand what your core modes and schemas are. And especially underneath what those core needs are that formed these schemas and modes to begin with, right? Because when you really look at these things, they all make sense. I can't tell you how many times I've heard from a patient that, this is crazy thinking, this is crazy behavior, like what's wrong with me? It all makes sense, and you'll see, right, that all the dots connect, right? And talk to your therapist about your own personalized case conceptualization. So in other words, how does this all fit? What's the blueprint that's me? Like, what blueprint are we following that is just me? And then lastly, do work between sessions. It doesn't have to be a lot of work, just a little bit. For example, identifying what central modes are getting activated. Right? So if you know you have a tendency to overcompensate or to get surrender to things, or to just get numb and shut down to things. And that's something that you're working on. Just note it, right? Work with your therapist on how you can bring these things into your daily life. There's 168 hours in every week. And most people are with their therapist 1 to 2 hours a week. So you want to just bring it into your real life a little bit, and then bring that back to your therapy the next week. And if you're doing these things and you're working through these things, you're going to see how much better you're going to feel. With that, we'll go on to the other videos.